everybody. I'm Anita Finley again, and here's another fantastic Zoomer Times TV show. I always get the experts, the best people. We don't do this casually. We choose people very carefully, and we have a real star today. For those of you who've been privileged to go to Broward Health Imperial Point, and I know no one wants to go to the hospital, but if you have to go, you want to go to Broward Health Imperial Point because they do marvelous things. I'm not going to use the word miraculous, but and the reason is they have great, I would call them people who are heading up all the various areas of the medicine that they perform there. So today we have Dr. Robert Raggi, R-A-G-G-I, right? Dr. Raggi is the chief medical officer there. And why don't we just start off and tell us, so when you get up in the morning and you have to go to work, what are you looking forward to doing?
Well, I like to make coffee and make sure she's happy before she goes to work.
Right.
And Broward Health has given me the opportunity to do innovative initiatives and follow it through. I like projects where I can bring back to the community, the patients, and to the people that we're giving our mission to.
Right, and so many people now are so fearful of going to hospitals or going anywhere. They just want to stay home because of COVID. What are you finding there at your hospital?
If I can talk to the community and the patients eye to eye, saying you don't want to do anything detrimental to your health. You want to protect yourself. I've gotten KN95 and N95 masks. Always wear a mask and hand sanitizer. Wash your hands often. But you're not going to live in a bubble for the rest of your life. COVID has changed everything. So you need to get the early detection medical things that will help with cancer-related issues, breast cancer, colon cancer, diabetes, and that type of thing. So you got to feel and you got to trust that medical personnel, clinical hospital personnel, have your interests and your health interests at heart. And we take precautions that I'm not going to mention any supermarkets or pharmacies or warehouse stores, but you got to trust the hospital clinical people that we're taking extreme precautions.
And is it true though that as the COVID rises as it has been, that you are going to possibly run out of personnel and supplies?
Supplies problem in the beginning. I think that's more under control, correct, right now. We were really dependent on foreign sources of PPE, personal protective equipment, and I think that's been solved. We're bringing a lot of those industries here. As far as the testing has been a problem. We use one testing platform. Broward has been have foresight and switch to another one. We have a quick COVID test. We have a DNA 99% point whatever proof of COVID. So we have a lot of resources there. We have an excellent team here. I mean, you got to look at Broward Health as the university center of Broward County. We have research, we have genetic research, we have physicians with all subspecialties, and we enhance our residency program. So we have a lot of doctors here published, and if you're going to think of Broward Health, I would think of two things. One, you have a university center in Broward attending to the community needs. It's state-sponsored or assisted so that we can help the community. That is our mission, to help the community. And we also have a wonderful patient satisfaction. Broward Health Imperial Point is known for its boutique Imperial treatment of the patients. So that's something you might want to consider.
Oh, absolutely. Everything you're saying is so true, because I personally know so many people, and I know just so many of the doctors and the personnel. I want to go and focus on you for a moment. Let's back off here. So you're an anesthesiologist, and you have been well trained all over the country. You've experienced a lot of the top medical schools. And so now you decided that Florida is a good place for you to use your skills. Are you happy here?
I'm very happy. I've reached the pinnacle of my career. I don't like to talk about myself, but I started out in a seminary in New York. I took that mission, went to medical school at Georgetown. I did my residency at St. Vincent's Medical Center, great hospital, Greenwich Village, New York. I've worked in Stony Brook University, Cornell affiliates in New York, and became the chairman of Anesthesia and the CMO there, and took my skills to California, met my lovely wife, and who I make coffee for every morning.
Nice.
And, I have grandchildren on the East Coast, and I moved to Broward because they've given me the opportunity to work on innovative initiatives and see them to fruition. So, it's a joy. It's a joy.
Well, you're joyful. I can see that in your smile. So tell everybody, what really are the duties of a chief medical officer? People from the outside aren't going to come in and say, I want to see Dr. Raggi. They're going to see their doctor, but how do you get involved?
Well, they can see me. I'm very personable, very social. They can see me, but and that has happened. But I look at the chief medical officer as the liaison between physicians and administration. The term C-suite, you have the chief executive officer, you have the chief nursing officer, you have the chief financial officer, and the physicians. In the past, I've looked at hospitals as a big building with a lot of equipment, and nurses, Florence Nightingale nurses who attend to the patients, and then there's physicians who come and go. But the physicians have the license and can admit patients, and they are a big part of our team. You got to understand, I'm a history buff, and the history of medicine has changed from the 20th to the 21st century. And more physicians have an office-based practice. We excel in hospital-based practice, contracted ER physicians, anesthesiologists, radiologists, pathologists, hospitalists. This way, some of the internal medicine, private family doctors can see their patients in the office and let the hospitalists take care of the needs in the hospital. We don't have women and children's at BHIP other than the ER, but they also have what they call NICUists and hospitalists who take care of obstetrical patients. So things are changing, and if you don't keep pace, somebody's going to catch up to you.
So someone once asked me if they want to go to the Broward Health Imperial Point because it has such a sterling reputation, but they live in Palm Beach County. Can they go down there and use the facilities?
Of course they can. We have very skilled subspecialties in all 4 of our regional hospitals. We have Broward Health Medical Center, real powerhouse with a lot of transplant surgery is new for them now. BHIP has a lot of surgical oncology with bariatric. I myself am starting the patient blood management. I work with Jehovah's Witness hospital liaison, but there's 40% of America who are anemic. So we're starting an anemia clinic, and everyone should know what their hemoglobin is, what their hematocrit is. If you're saying at the end of the day, I'm tired, I'm listless, and I need more energy, you might be anemic. You might have iron deficiency anemia. So we're starting a center for that, and we're going forward with that. And that's a topic for another situation.
Oh, absolutely. We'll have you back on that. So it's called blood management? I have not heard of this.
It's called PBM, Patient Blood Management. The Joint Commission has special certification for it. I got involved in New York. I went to California, became the first community hospital in the country to get the Joint Commission certification behind the University Centers of Hopkins and Georgetown. And Broward is doing that journey, and we do it now.
And what kind of tests? I'm just going to dwell on this for 1 minute. What kind of tests can tell if someone has blood management?
I'm going to give you two pretty pragmatic examples.
Okay.
If you get a transfusion, is basically an organ transplant. So if you get a kidney transplant and then you need blood after the surgery, the body will note that the blood is a foreign body, an organ, and mount the immune system. So the immune system will get stirred up and may attack the kidney transplant.
Ah,
There are infections from blood. Blood is not the safest thing in the world. We do make sure that it's safe and as best as we can. But the transfusion triggers at what level to get a blood transfusion has changed with modern science.
that's very interesting. See, we don't really get to talk about this. My guest is Dr. Robert Raggi, and he is the Chief Medical Officer at Broward Health Imperial Point. We're learning a lot about a lot of things, which I'm always happy. I mean, I know that it's interesting because when you're an anesthesiologist, people used to think that you just go and someone's going to have a baby, you're the anesthesiologist, but that's not true. A lot of anesthesiologists deal with pain medicine, and what are other kinds of things that you specialize in?
The subspecialties of anesthesia are similar to all the subspecialties of medicine. There's pediatrics, OB, cardiac, intensivist, pain management. I took my boards with University of Virginia, but I got to love anesthesia. I'm very glad I found it. Anesthesia is the fulcrum of the operating room. Basically, vigilance is their motto and keeping the patient safe. But I dealt with a lot of surgeons in my career and the internists. So I credit that with some of the skills in interpersonal and interphysicianal relationships that I bring to the CMO job. Anesthesia is very important, as all the specialties are.
Yeah, thank you. That's because I've noticed that. But let's go back now to helping people with COVID, because I know that's on everybody's mind. Why don't you tell everyone what you think that people should actually, besides washing their hands and staying, either staying home, or what other things can they be doing? Could they be taking more, elderberry? Could they be taking all sorts of other supplements that will help them? I mean, especially people with high blood pressure or diabetes. What other things can they do?
I'm a big holistic medicine, nutritional therapy. I work with the drug discovery team in Georgetown, and I found that a lot of cancers, a lot of diseases are triggered by the genes having an on-off switch. And what causes the on-off switch? Often it's a nutritional deficiency. It's an insult from the environment, whether it's virus, bacteria, or a chemical agent that turns it on and off. So you need to protect yourself. I have a relative right now, a dear nephew who has COVID, and the first thing I did was bring him my vitamin regimen. You need to be healthy. You need to take your antioxidants, your B and C, which are water soluble, so you don't have to worry about how much you have to take. D and E, you do have to measure it, and beta carotene or vitamin A, but not orally. You take it in the form of beta carotene. Zinc was joined with the hydroxychloroquine, and basically that works by bringing zinc into the body. Zinc is a very poorly absorbed mineral into the intracellular part. But I think you need to keep your health. I think every patient should know their blood count, their hemoglobin, their hematocrit, their hemoglobin A1C, their risk of diabetes. These patients are having a tough time with COVID and, that type of thing. So health and wellness is the most important thing. Exercise, sleep, tincture of health. So that's wellness. Those are some nutritional vitamins, but it's the basics: social distancing, masks, whether they're regular surgical masks, KN95s, N95s, and hand sanitizer, keep your hands clean. I was a germaphobe before all this started, so I'm kind of glad that handshaking has gone away. And, I think
Wow.
that's good. And if the public should know that there's going to be less flu this season because of the masks, the social distancing, and all the things we're doing for COVID.
I have to stop you on that you said that. I have 15-year-old triplet grandchildren in Miami. They always had colds. My family said they haven't had colds for 9 months. It's been fabulous. I guess it's because all the other precautions, right?
That's a big part of it. It really is a big part of it. So we're seeing a surge in COVID. I'm trying to be politically correct. The snowbirds are coming. We love them. We love our tourism industry. But there's a surge in the Northeast, just like last year, and it's coming south. So we have to protect ourselves and our loved ones. One of the most important things that I think the public needs to know is the air exchange rate of a room. If you go into a restaurant these days, you'll notice that it's cold. And the reason it's cold is the air conditioning keeps on flowing, which is a good thing. This way, the air exchange. Operating rooms change their air exchange every 5 minutes. I saw an article that airplanes are changing it more than that, which is safe. And that's important. So you have a certain immune system for COVID, where if you get a couple of hundred, your immune system can handle it. But if you get more than a couple of hundred of viruses in your oropharynx, your nasopharynx, you're likely to get COVID. Hopefully you have the immune system built up to take care of that. But air filtration is very important.
Glad you brought that up, because I have been keeping my apartment a little bit warmer, but I guess I should put the air conditioning on stronger.
Well, I'm
I don't go out.
I'm talking about restaurants and public
Okay.
places more than your apartment. I think that, you're social distancing and you're keeping the triplets and the germs away at certain points.
Right. As a matter of fact, I suggested that they come up from Miami because they've all been doing so well, and they could come into my apartment, but they said we're not doing that because their children are still going to school a couple of days a week, and they could be bringing something in. So as a germaphobe, you could agree with that.
Yes.
Yes.
No, it's nice to have social events outside because the breeze is a natural air circulation. There are very few documented cases of people getting COVID outside.
I don't know if you have a dog, but a lot of us dog walkers, we're so happy our dogs don't get a virus, it's interesting, isn't it? That it's a human situation, but not for pets.
If you go back in the history and the microbiology, it's a SARS coronavirus. We've had this before with SARS. It is in bats. Tigers get it, and there are animals that get it, and that's why the markets in China were at risk because there was a lot of virus carriers and animals out there.
Well, it's funny. After talking with you, I am so impressed that they found you, because I don't think I've spoken to anyone in Imperial Point as a CMO yet. I've spoken to the CEO and all, and you have a very nice CEO too. I mean, he's young and he's smart, and so that's important for you because you all have to work together.
Well, I'm young too.
I know you are.
Sun age.
You're young and attractive, and you have your hair, which is important.
Yeah.
But the nice thing is I can see why they like you, because you're very down to earth. A lot of people, of course, you knew this old story, the doctors are the gods and we can't, whatever they say, we do. No, well, people get on Google. Google's been the destruction of that God-fearing thing. I know doctors are horrified. Some aren't. They like the fact that their patients come in with more knowledge.
And that's important. True facts and be able to communicate on a real level. I think it's very important, the communication and the connection with the community. I know you're on our community board. I appreciate that. And that is really one of the, real spark plugs in our hospital We're looking to open up the volunteer, courtesy shop at some point. And if anyone out there is listening, has a relative in college or a volunteer out there, we will help mentor you in any career that you want to go in healthcare.
Well, this brings up a good point. Of all your hospitals, and I've been to all of them, the one there, the Imperial Point, has the best gift shop of all of them. I go there and I always rave about it. People laugh at me, but I buy all my Christmas, all the special gifts that I want. They're inexpensive, and of course you have volunteers there. But so everybody who's listening, if you want to forget going online, you can go into their gift shop. It's fabulous. In fact, I was wondering, is your gift shop online? If not, maybe we ought to do that.
Let's talk on that. I got to say, it's funny you bring that up because my wife tells me to stop shopping Amazon when she goes to sleep. But I sometimes I judge a hospital by the gift shop. I go in,
wow,
and I can tell you one thing. I was in the Louvre a decade ago, and they were doing reconstruction. So I just went to the gift shop, and I saw all the pictures that were hanging in the Louvre, and got a couple of souvenirs. So gift shops really tell the story.
Well, it also makes money for the hospital, which is very important. And that's another thing that I always tell people, in your will, leave Broward Health, please put it in there. They do so much. They really are one of the Broward Health organization really takes in a lot of people that don't have a lot of money, unlike some other hospitals. And they don't turn anyone away. And you should be so proud of that, Dr. Raggi, because you know the story, and you all, that's why you don't make as much money as you could.
That's why I'm here, because they take care of the needy.
Yes.
The mission, it's not just a business. And, will I leave money to a hospital? Yes. I will dedicate it to a certain cause that's close to me and that I see the need in my, workings here.
That's right. And if people are interested, you can call the Broward Health Foundation and they can set up any kind of a thing that you'd be interested in. But let's get back now to the hospital. So when someone comes in there, you have especially at your hospital, there's it's very open air as compared to some hospitals. It's a good feeling when you go in. There's a nice information center, and then you go right over to the one side, and then they check you in. So then what really happens is well, of course, there's an emergency center, and that's different. If you're having an emergency, you go right in, and then they take care of you. But the people who check in, are they doing this because they're there for some sort of surgery that's planned?
We have a full compass of services. I got to commend, and I have, to Henry, the manager. The front staff is wonderful. We give an award every year for our star employees, and I think 3 out of the 4 candidates were from the front office. So they're really great people. I've dealt with them. I've had friends and family who've dealt with them. So, we pride ourselves on customer service, and that's most important. I mean, you come into the hospital, you're scared. What's wrong with you? What are you gonna do? You're gonna fix me. So we have a full gamut of outpatient services, laboratory, X-ray. It's interesting. I'm not going to say who, but we have one of the highest technology mammogram that exists.
Really?
A 3D mammogram that is wonderful.
Tell us about that.
Well, it's 2-dimensional versus 3-dimensional. So you get a better picture. You can see a smaller pixel, as we talk about, and you get an earlier diagnosis. I mean, the trend in medicine is technology and earlier diagnosis. I've talked to some geneticists and people working on personalized medicine that the human body really can live to 120, 100 plus or minus right now, but we have to, take care of nutrition and our well-being and a lot of the toxins that come in our body. But early diagnosis is key. And there's so many things that have early diagnosis in medicine, mostly cancer, inflammation, and I'll put another plug in for generalized well-being, we want to decrease the inflammation in our body. Turmeric, which I love and take every day, is a natural decrease of inflammatory inflammation in our body. And you don't have to take Advil, aspirin, or Tylenol. Advil is sometimes bad for your kidneys, Tylenol for your liver. Turmeric is natural, and it's a wonderful medication.
I love you more than ever because I make soup and I always put turmeric in it, and I did,
Oh.
but you mean, yeah, I do it the natural stuff. I don't really do it as a capsule, but so that's interesting. Yes, I'm very much into the kinds of things you're talking about, but turmeric, that's good. So I know you keep reverting back to that, and the fact that you're a germaphobe, I was thinking about this too, that it's good. I appreciate it. So because you see what it's done, it's developed your personality even more, because since you can't shake people's hands, you have to smile at them and talk to them. So that's good, right?
Yes, I give you affirmation.
Yeah, well, you see a lot of people look at someone like you and, oh my goodness, he's coming to talk to me, and they get so nervous, but you're certainly friendly. And the seminary part, I know we skipped over that pretty quickly, but that means that you have a big heart and you want to do something good, and you turned it into medicine, which is so important. And the fact that you are so well-rounded, I love this.
I'm not the sharpest tool in the shed. I'm going to be the eclectic. I'm going to gather information. Information is power. And I want to be able to try to be a Renaissance man, even though my grandmother said, Bobby, don't be a jack of all trades, be a master of one. Well, that's called obstinate defiance, as my wife says.
That's lovely. So just take a second. Tell us not only about your grandmother, tell us about your mother and your grandmother, because I've always looked at people and I always ask them, what was your mother like? What was your grandmother like? Because that says so much. Bet they had a beautiful head of hair.
It's called formation years. What formed you? My grandmother was born and raised in a Depression era. She was very wealthy during the Depression. She had a junkyard in Brooklyn. When World War II came along, the government needed steel, rubber, and a lot of other stuff. And I could go on and on about her. My mother was a wonderful person. She was the queen of the prom. My father was the king of the prom. And my father was a New York City police officer. And unlike other doctors who sat around and talk about medicine and science, we talked about criminal law, political stuff, civil law, and everything. I told my daughter, I said, if you're looking for a career, look at the first 2 pages of the Daily News or the New York Post. Everything is legal. It's either civil law, criminal law, and whatever. So I had a very good childhood, and I thank the Lord for that.
Dr. Raggi, I have enjoyed this so much. And of course, I always have doctors say, well, what are we going to talk about? I said, just relax. We're going to figure it out. I definitely want you on again. You're terrific. And we're just running out of time, and just keep doing all that good work. And let's see if we can get the gift shop online, because I love the gift shop. Tell your wife I said hello, okay? Because she seems wonderful.
Who, my wife?
Yes.
So I'm gonna give you 2 closing comments.
Okay.
It's not about me. It's not about the hospital. It's about the patient and the community. And that's our mission. We really want to make our community a better place, and we're here for you. And if we get, comments or suggestions, recommendations, please send them along, because we listen, and that's where the real ideas come from. I would like to talk about patient blood management and the anemia crisis in the country.
We'll do that another time. I'm going to get you on again, if I may.
All right.
And the other thing is, I'm going to ask the board, the foundation board, maybe they'll have a speaker and ask you to come talk to them. I think they would love that. So let's see what I can do.
I can overcome my shyness and talk.
Thank you so much. And we'll talk with you again.
Thank you very much.
Bye.
Appreciate the opportunity.
Okay, it's my pleasure.
Thank you.